Good afternoon, everybody, and a very warm welcome to this annual general meeting of the Surrey and Sussex Healthcare NHS Trust. Thank you very much for joining us and for participating in this event. It has certainly been a very eventful year. I'm sure you appreciate that, and I hope that you find the presentations today interesting and engaging, and that you're able to ask questions as we go. COVID has had many impacts on us all, as you'll appreciate. Possibly one of the longer lasting impacts has been in the use of technology. And we're all becoming accustomed to speaking to each other remotely using mechanisms like Microsoft Teams. So this is an unusual AGM, but who knows, in the future, it may be just the way that we do things. So one or two comments to start with about rules of engagement in this meeting. First, some of the speakers you will see in a room at the Trust. I'd just like to emphasise that we set huge store by staff safety. We are compliant with rules of social distancing, and this is a COVID secure room away from the main part of the hospital. We are observing social distancing, and even if the camera makes it look as if people are sitting close to each other, they are actually at least 2 meters apart. The room is regularly cleaned and has been risk assessed so that speakers don't need to wear masks. We want this event to be as interactive as possible, so we do encourage you to ask questions as we go, and after each presenter there will be an opportunity for questions to be asked and answered. Please don't wait to ask your question, but put your question down on the screen as we go, and we will try to answer them later on. Sometimes there is a bit of a delay in getting the question up of 30 seconds or so, so don't wait to the very last moment and then be disappointed. But there will also be an opportunity to ask questions at the very end of the meeting too. So to ask a question, you should see, if you hover your cursor on the screen, you should see a bar across the center of the screen towards the bottom, and the penultimate tab on the right says Q&A, and if you click on that, a box pops up on the right hand side of the screen. That's where you type your question, and there's a little arrow right at the very bottom of that box. Click on that to send it, and we will do our very best to pick the question up and answer it. Now, this has been a very unusual year, and it's been dominated in the later stages by COVID, obviously, which has been a huge upheaval. I have to say, as somebody who chairs the Trust but is not involved in the day-to-day running of the Trust, I'm not an executive director, I have been hugely admiring of the response of the Trust to this crisis. The speed, the decisiveness and the calmness of the response has been, I think, quite exemplary and inspiring. We do now face new challenges, and you will hear about that as well. The challenge of addressing the backlog in elective surgery, while also guarding against the risk of a second wave of COVID. But I would like to pay tribute to our staff, who have shown fantastic professionalism, selfless dedication, compassion, flexibility in taking on new roles, and also, let's face up to it, courage as well. It takes courage, I think, to work in a ward where all patients have COVID, or to work in intensive care. So I do pay tribute to our staff. I've felt enormously proud of their efforts during the first 6 months of this year, and I think they have really demonstrated the ethos and values of this Trust. I think it's also fair to acknowledge that quite a number of staff have experienced the symptoms of COVID, from the chief executive down, and very sadly 2 members of staff and 1 volunteer have died of COVID during these months, and our thoughts and prayers are very much with them and their families and friends. But although COVID has been such a dramatic event, much else has happened besides in the Trust, many challenges and many successes, and you're going to hear about that in a few moments. So if I could just turn briefly to the agenda for this afternoon. Michael is going to kick off with an overview of the year. He'll pass on to Ian Maheshwaran, our Chief of Surgery, who is going to talk about COVID-19. Paul Simpson will talk about the money. Jane Dixon and Chris Connor and Ian Wilkinson will talk about our groundbreaking approach to the management of dementia in the hospital and the national award that we have won. Avinash Aravamudan who's one of our consultant paediatricians, will talk about our wonderful neonatal unit that opened just the other week. And then we'll have time for questions at the end. But do, as I said, please ask your questions as we go of each of the speakers. So that's enough from me, and I'd like to pass over to our Chief Executive, Michael Wilson, to give an overview of the year. Over to you, Michael.
Well, ladies and gentlemen, colleagues, partners, stakeholders, again, I'm very privileged to be talking to you again this year. Chairman has already commented on what a very strange year it's been, some highs and some lows, and we'll talk you through those. But I wanted to say, first of all, what's that? You want me to start again? Tell me that.
Richard, could you so it's gone off from live. Okay. 3, 2, 1.
Yeah.
I can hear you.
Good afternoon, everybody, colleagues, stakeholders, members of our community, members of staff. A big thank you to everybody for helping us get through what's been a really different year, and a year that I think most of us will remember for a very long time. Lots of highs and lots of lows, but again, very privileged to be able to talk to you today about the year that we've just had. Next slide. Next slide. Okay, so thank you. So there's just a bit of an overview about the Trust. For those of you who are new to SASH, you'll see that we have a number of different places that we operate out of, including Crawley, which is very important to us, and a very important part of our local community, Horsham Hospital, Caterham, and Oxted. The other illustrations on this slide just tell you the size of the population that we share, 535,000 people, and that of course is growing, and the number of births that we have in our maternity unit, and of course not just about the number of deliveries that we have here at SASH within the hospital. It's also, on top of that, the number of ladies that we actually look after, provide antenatal care for. That's about another 1,500 patients throughout the whole of Surrey and Sussex. Next slide, please. So we pride ourselves here at SASH as being one team, and you can just see again the number of staff that we have. We have 10,000 members within our community, 200 volunteers. I'd like to say a big thank you to all of those, and including the League of Friends. And I know it's been really difficult, particularly over the coronavirus period, for particularly our volunteers, who many have not been able to come to the hospital because they've been isolating, and I know it's been a source of frustration, but we're looking forward to welcoming you back as soon as it is safe to do so. Obviously, there's a whole range of things that we're very proud of, including Buster and our cat, Jasmine, who provide a lot of support really, I think, for particularly our vulnerable patients and our vulnerable groups. Next slide, please. So within the Trust, of course, we have a group of executive directors, and many of them are here today. We also have a fantastic group of non-executive directors who provide support, challenge and guidance to the executive team. And I'd like to thank them really for the very important part that they played, really since my tenureship, but also particularly this year, because it has been a very, very different year for most of us. Next slide, please. So what was it like last year, really? So we ended the financial year, and Paul Simpson, our finance director, will talk a little bit more about finances later, with a £7.1 million surplus. And really that was astonishing, really. A lot of hard work went into delivering that, and it's actually helped us sort of think through a whole range of different things, but also more importantly, it's put us in a very strong financial position going forward this year. You'll be aware that each hospital in England has a national staff survey every year, and I'm very pleased and proud to say that this year the Trust has done exceptionally well again, and continues to be in the top 20% throughout the country. And that's about, I think, some of the care and attention we've been paying to our staff, particularly around health and well-being. Of course, there's always more that we can do, and we're working very hard with our staff to see what improvements we can make. Today, the NHS People Plan has been released, and we'll be working through that with our staff to think about how we can improve their working lives and how we can perhaps add more flexibility to their working lives, particularly when they're at work. Next slide, please. So a year ahead, we're one of the first trusts in the country really to embrace some of the digital techniques. Prior to coronavirus, we were probably using or having about 10 sessions a week with patients, and now it's about 500. So that's brought some significant benefits, particularly to patient experience and the quality of that experience. So many frail elderly patients who actually do use some of the digital platforms that we've been putting in place really like it. We get some really good feedback. Of course, it's not for everybody, and some patients will have to come to hospital to have tests and to be examined. And we will continue to be very flexible around that and ensure that we are directing our digital platforms for those patients where it's clinically appropriate. I think one of the proud things this year for the organisation was winning the award for the best dementia-friendly hospital in the country. And my thanks go to all the staff involved, particularly our lead clinicians and consultant nurses. And I think it's really an opportunity to celebrate some of the wonderful things that have been happening around dementia care, and some of the ways in which we've been able to provide services and facilities for patients that we perhaps weren't previously doing before. Next, we promise slides. Next slide. We continue to develop the infrastructure within the organisation, and we've been very fortunate really this year to put a lot of new things in place. We put a new dental unit in place, which is our Aldridge Blake unit, and a new women's centre, and a new gynae outpatient centre. And I think those facilities offer a better patient experience. They're a little bit more away from the main part of the hospital. They're in nicer surroundings. And I would like to thank our teams here, not just for the way in which they've designed those facilities, but for the speed that they've been able to pull plans together and to work with our contractors to deliver these programmes on time. You're going to hear a little bit later about the new neonatal unit. It's absolutely stunning. We've had tremendous support from our community and from our staff, doctors and nurses and neonatal nurses, to really develop a fantastic facility, and you'll hear a little bit more about that later. Next slide. So the quality of care within the organisation, I'm very pleased to say, continues to improve. We're not complacent. We think that we've still got more to do. We want to be one of the safest hospitals, if not the safest hospital in the country, and we're just about to deliver and develop our patient safety strategy. We'll be working on that very hard this year. A couple of highlights. So falls remain under the national average. You can read some of these things if you can see the slides. But consistent delivery of 98% of harm-free care. And that's fantastic. I think it's fantastic in terms of the work in which the clinical teams have done in just looking at how we view the patient journey and view the patient experience in a completely different way. There is more to do, and we're on that journey now. But I think it's something that we should celebrate, particularly the huge amount of work and effort that has gone into developing some of these things over the past year. Next slide, please. So some of you will remember, and you will have heard, that we have had a long partnership now with Virginia Mason in Seattle. We're in the 5th year of that partnership, and we've really used the tools and techniques to embrace change, embrace transformation, and to develop a suite of tools and techniques that allow us to think about the world in which we operate in and work in a very different way. I think the other thing that it brings is an opportunity for all members of staff to engage, so that everybody feels they can make a contribution and start to think about how they transform their services so that our patients get the best possible experience, the best quality that we can provide, that their journey through the hospital is as safe as it can possibly be, and of course that those patients get the best possible clinical outcomes for their onward journeys home. Thank you. Next slide. So the landscape across the NHS is changing, and we're working with our partners in Surrey and in Sussex. You will know that our services span both Surrey and Sussex, and the population split is about 50-50. All systems now have moved into what are called integrated care systems, and we belong to Surrey Heartlands, but we also look out and reach out into the integrated care system within Sussex, because it's very important to us that we ensure that we are servicing the needs of our population base within Mid Sussex and North East West Sussex. Next slide, please. So, developing our charity, we've had some fantastic events this year. Actually, we're very pleased that we were fortunate to be partnered with Gatwick Airport, and we've had a huge number of fundraising events, from Run Reigate to marathons to walks. We've raised a huge amount of money that we will be able to invest in helping make our services for both patients and staff the best that they can possibly be. Next slide, please. So Ian will talk later a little bit about COVID, but I wanted just to touch on that for a moment and say a tremendous thank you really to all of our staff. I'm incredibly proud of the way in which they have responded to not just a national pandemic, but a global pandemic. And it's given staff, I think, the opportunity to think about how they would work in new and different ways. I think from a technological perspective, we've moved probably 10 years ahead of where we would have moved in about 3 months. But I also acknowledge that our staff are very tired. It's been very, very difficult for them. It's been very, very emotional. We have had to work and deal with things that we have never experienced before. So I'd like to pay tribute to all of our staff, but I'd also like to pay tribute to our community and to say thank you to everybody within our community, because I know that it has been very difficult for all of you as well. We've all been working with something in coronavirus that it's taken a little while to understand, but I think we are now more confident in the way that we are dealing with it. And at the moment, you know, from a hospital perspective, we are seeing hardly any patients come into the hospital with coronavirus. Next slide, please. So Again, it's been an enormous effort. I think one of the things that was most difficult during the pandemic was the number of patients that needed intensive care, and those that the huge or larger number of patients that needed to have support on a ventilator. And Ian will touch on those things again in a moment. Next slide. Next slide. Okay. So people do worry very much about coronavirus, and as I said earlier, we are learning more about it and we are understanding more about it. But during the pandemic, you know, we treated about 1,100 patients who were positive with coronavirus, and 868 patients were discharged home, and that's absolutely fantastic. And I would like to pay tribute particularly to our critical care staff, because whilst we did, you know, some patients didn't recover from coronavirus, actually the mortality rate within the hospital was actually one of the best in the country. Next slide. And again, I think our chairman, Richard's already mentioned, you know, we did lose some very staff over that period of time that were very dear to us. And I think just to take a moment to reflect really on the fantastic contribution that they all made to the hospital, to the NHS, to their families, and to the local communities. And I'd like to thank them and their families for everything that they did and the support that they gave us and the staff here at SASH. Next slide. So supporting our staff, there's been a huge amount of media attention on this right across the NHS. We've done a huge amount of work in ensuring that all our staff have risk assessments, so that we are pretty sure that actually we are safeguarding our staff as much as possible. And that meant that, you know, often people would have to, you know, shield at home when they were at risk, or perhaps take on new and different roles to ensure that they weren't put at risk. And I think kind of the well-being stuff that we've been doing at the moment really is really quite pioneering, actually, and it's helped us start to think of how we must work with our staff in new and very different ways. Next slide, please. So thank you again to our community. I think we've had fantastic support. I think it's very difficult to name everybody who helped us, particularly externally, because there were so many. And I think particularly Gatwick Airport and the staff at Gatwick Airport, but all the volunteers, all those people who work and live locally, the care and support that you showed our staff was absolutely tremendous, and I'd like to thank you for that. Next slide, please. So that's all from me. I'm going to hand you over now to Ian Mashwana, who's our Chief of Surgery, who's going to talk a little bit more about coronavirus.
Thank you, Michael. So I'm going to talk about our response to coronavirus and the next steps. As Michael's already alluded to, being a respiratory, predominantly respiratory virus, this did impact our intensive care footprint and capacity, and there had to be a lot of reconfiguration that our staff did extremely quickly and very responsibly to manage this pandemic. We normally only have 8 intensive care beds. At the height of the pandemic, we were at 33, effectively quadrupling our capacity, and as Michael alluded to, with good results, but unfortunately we weren't able to save everybody. We treated almost 100 patients through our intensive care. It did allow us to care for those patients that needed us the most, but I accept as a Chief of Surgery that meant that a lot of you have had to wait for elective procedures because we had to pause all surgery apart from emergencies and cancer. And I'd like to thank those people for your patience with us really during this time, so that we could concentrate on those patients that needed our support the most at that moment in time. We also noted that the whole wards were moved here. Michael alluded to the fact that 160 nurses came from other wards onto the intensive care so that we could scale up that capacity. And you can see there on the slide, you know, a tweet from one of our staff who'd worked during her annual leave, and not only felt welcomed by the intensive care staff into an unfamiliar environment for her, but and I think it really shows how, as one team, we really performed. And I echo Michael's thoughts about the fact that our intensive care team and the wider nursing staff have done a fantastic job during this period, and I'm immensely proud of them. As I said, the one team value has never been so evident. It's one of our core values, and I think from the top down, it's something that that runs through this organisation. I was fortunate enough and very privileged to do a shift on ITU, a night shift on our Tilgate Annex ITU at the time, which was our sort of second ITU, and work alongside teams of intensivists, anaesthetists, ITU nurses, and other ward theatre nurses, ODPs, who all were looking after our patients on intensive care and just stepping up without hesitation. Many of them had come from different nursing backgrounds where they weren't used to the intensive care environment, and within a few shifts they felt comfortable and they were being supported by our regular intensive care doctors and nurses, and it was really, really heartening to see that. Next slide. Obviously, during this time, as I said, we had to pause a lot of our activity. We found other ways to see patients. We had to suspend a lot of non-urgent appointments and procedures because it simply would have been unsafe to bring people into the hospital. And we therefore increased the number of video consultations we've done from almost 10 a week pre-COVID to 500 a week now in June. And if there is anything positive that comes out of the pandemic, it will be that things like this will be here to stay. Different specialties within the hospital will find the video conferencing much easier to use. Sometimes in surgical specialties, we often have to examine you, and therefore we may have to bring you in for a face-to-face consultation. But I think it will reduce the need for patients certainly to come into the hospital every time to see a consultant or doctor. Next slide. We also use technology to help with our loved ones too. We realised that we had to restrict visiting during the pandemic, and I can't think of anything worse than dropping off your relative who gets admitted to a hospital and then not being able to go and visit them. So we used technology to facilitate messages getting to patients, video calls, tablets, telephone calls to loved ones, a messaging service, and also making sure that our staff rang relatives to keep them updated. We obviously continue to facilitate visiting in exceptional circumstances such as end of life. What's really important during all of this is that we increase our knowledge of COVID as a disease and expand on our knowledge base so that should it come around again, we can do better. And certainly talking to my ITU and anaesthetic teams, they were on webinars, reading everything out there to get the best results for our patients. And alongside that is also the fact that we've recruited patients into the recovery research trial, over 100 patients, which is great, so that we can learn more about the disease and what treatment modalities may influence outcomes. And thank you to those people that took part in this trial. This was a trial really looking at things like antibiotics, steroids, or anti-inflammatory medication, and see whether it had any impact on people's outcomes. We've also recruited to other national trials, particularly in the surgical division, around operative versus non-operative management during the pandemic. We had over 800 patients that recovered from coronavirus, and you can see here, top left there, my colleague Ben Mearns, the Chief of Medicine, talking about some elderly patients that recovered. Unfortunately, COVID did tend to affect elderly patients, but it shows that people can recover from this no matter how old they are. We've got intensive care team there taking a patient out to give them some sunshine, Some of these patients were staying a significant length of time, sometimes 30, 40 days, 50 days on intensive care there for somebody that was able to get home. And it really just demonstrates how our staff have gone the extra mile for our patients during this time. Next slide. So where are we now? We have resumed all surgical specialties, and as Michael's alluded to, we're aware there's a backlog and we are ramping up all of our capacity to deal with this. There is a video that's online on the Trust website where we put in lots of safety measures to make it really safe for the public to come, not only to face-to-face outpatients, but have safe surgery. We're completely committed to this around testing, isolating, and making sure that our PPE is all in place, and our hot and cold pathways are there as well to ensure that you're getting surgery in the safest possible way. Once again, thank you to our community. We couldn't have done it without you. Your clapping, your donations, your support, and the fact that many of you would have potentially stayed away from hospital during the pandemic gave us that bandwidth to really look after the patients that really needed us at that time. Also, thank you to our GP partners who will have managed a lot of patients in the community during the height of the pandemic. So thank you, and please continue to social distance to prevent the spread of the infection.
Thank you, Ian. Okay, thank you for Ian's contribution there. So I'd like to introduce you in a moment now to Paul Simpson, who's our Director of Finance, to talk through the annual accounts.
So before Paul comes along, we do want to encourage you. My name is Gillian Francis Masanu. I'm the Director of Corporate Affairs. We recognise that some of you may not have been able to see the slides as we were speaking, and we're posting those right now on the news section of our website. So please do go there and make sure they will be available for you to see. We also want to encourage you to ask questions, and we have one posted right now, which I'll ask Ian. It says, Ian, how has staff morale been affected by this hard work since March?
I think there is no doubt that staff morale remains high, but we completely acknowledge that our staff are tired, both mentally and physically, from all the extra work that they did during the pandemic. We put in lots of support for them around counselling. We've got peer support and other things that we've laid on to ensure that their psychological safety is really paramount to us. I'm aware that we're ramping up activity quickly, but I want to protect the staff as well from effectively burning out.
Thank you very much. I've got another question here. It says, Ian, what reassurance can you give to patients and their families who are concerned about coming to hospital, maybe for a procedure or for an appointment?
Yeah. So certainly for appointments, my colleague Lucy Weeks has actually posted a video online about that. So we're staggering our appointments. So previously you would have been used to coming to an outpatient clinic and having 40 people in the waiting room. Now we're doing less face-to-face consultations, and we're staggering patients so that the waiting room can't get anywhere near full, and there's social distancing within the waiting room. We're cleaning the rooms down between patients, and obviously our staff will be in PPE in terms of a face mask and gloves and gown for any patient contact within 2 meters. So that's protecting both our staff and our public. Surgery has been well publicised, concerns about the risk of developing or contracting coronavirus around the time of surgery and the adverse outcomes from that. And as a result of that, there's been, we've got a rigorous testing process whereby all patients are tested before they have any surgical procedure. There are varying levels of quarantining beforehand to ensure that your risk of picking up the virus beforehand is also minimised. Again, we've got cold pathways whereby those staff looking after you when you come in for your operation won't be anywhere near staff looking after COVID patients, and this will all be sort of segregated, as it were. We call it a cold pathway and a hot pathway. Our numbers of COVID in the hospital, as Michael has alluded to, is very low. Almost zero. But we are constantly monitoring our rates, local numbers, to look for any rise. And if that was the case, I would have to pause surgery again. I would not put any of my patients at risk if I felt that was the case. But currently, it's really safe to come in and have your surgery. We would always hope that coronavirus might go away, but I think it's going to be here for a while. And we're going to see peaks and troughs of it. But at the moment, I feel confident that we've got everything in place to perform safe surgery on our patients.
There's another question there for you, Ian. It says, how many members of staff were unfortunate enough to suffer COVID-19, and what learnings do you have to reduce future contamination?
I don't know the figure off the top of my head of the number of staff that got COVID-19. It was interesting. I sat in an office with 3 colleagues that all got it and were off for 3 weeks, but me myself didn't get it, fortunately. So I think one of the things for the future for us is around PPE, hand washing, and I think one of the frustrating things for us is the fact that the guidance kept changing quite often, and we had to respond to that. There's no doubt that testing has ramped up over this time as well and has allowed us to test people quicker on the day. And we've now got a huge volume of knowledge around how we can streamline our pathways should this happen again.
Thank you very much, and please keep your questions coming in.
Thank you, Ian. To introduce Mr. Simpson, Director of Finance, talk to you about our financial accounts.
Good afternoon. So let me take you through the money and the audit and approval process. So our annual accounts for 2019-20 were approved by the Trust's Audit and Assurance Committee in June on behalf of the board. We received an unqualified external audit opinion from our external auditors, PwC, on the 24th of June. There were no material issues, and our audit was completed remotely, and that strange diagram that's just faded in is an example of how we did some of that remote work. So this is a schematic. It's actually of our acute medical unit, and one of the issues we had was how could we demonstrate to the auditors that we valued our estate correctly. So one of the unsung heroes that we had was somebody called Neil Pritchard, who works in our computer-aided design part of estates, and he had to shade in these schematics according to the different valuations per square metre of the hospital, and then record that and send it over to the auditors. And he had to do that for every square metre of the entire site. And that's the kind of thing that we needed to do. Next slide, please. Michael's already said that the surplus we achieved last year was £7.1 million. That's on a turnover of £372 million. The chart that you can see there shows the history of the Trust's finances since we were created in 1998-99. And you can see at the end there, that's the £7.1 million. The bars represent the underlying financial position, where you see a gap between the line, which is our reported surplus, that describes where we've had some one-off funding. In 2019-20, that one-off funding was £4.3 million, which was called Provider Sustainability Funding, which we were paid because we managed our financial position effectively throughout the year. Next slide, please. So that's our 4th consecutive year of surplus, and what that means is that we have finally properly recovered the cash deficit from our past. Many of you will know we had a bit of a checkered past. The bit in the red circle shows deficits of over £25 million that were sustained for several years. So not only have we recovered the cash deficit this year, we've actually halved our borrowing, and I would say that it's probably the best financial position that the Trust has actually ever been in. On value for money, our auditors also give us an opinion in respect of whether the Trust has achieved value for money in terms of how it operates, and we had a good opinion on that. They call it unmodified, but that's a good opinion in respect of that by the auditors. And in the year, we continue to treat more patients and make significant investments in services while improving our productivity. The numbers that you can see on the chart are our reference cost, and then something else called the cost per weighted activity unit, which is something used in the model hospital. Our reference cost at 82 is the best of any acute trust in the country. Our cost per weighted activity unit, which is £2,791 per unit, is the 2nd lowest cost in the country. The Homerton managed to be the lowest cost trust in the country. One of the major successes of 2019-20 was around our nursing agency costs, and nursing agency has been a significant issue here at SASH for some time, and you can see that chart showing a dramatic reduction in a year. So in January 2019, we spent nearly £1 million in that month. That's just 1 month's expenditure on agency nurses. In January 2020, we spent £300,000 on agency nurses, and we just had a board meeting where I can say that we actually only spent £134,000 on agency nurses in June. So that's pretty good. Not much to do with me. This was mainly to do with the chief nurse, the director of OD and people and their respective teams. And we managed this by 3 things really. One was a recruitment campaign, which meant we've recruited a significant number of overseas nurses and UK nurses. We've got a more commercial arrangement around our agency providers now, and we've reviewed our bank arrangements, which means we pay our bank staff just a little bit more. Those 3 things have helped this to happen, and it is a significant improvement, and that provides a significant financial saving. This weird diagram is from the model hospital, which is a huge database that NHS England and Improvement provide that includes a huge number of statistics about productivity, clinical performance, productivity and money. This chart combines several different things from that database. So it includes the CQC ratings, or are you outstanding, good, requires improvement or inadequate. So green is good, the ones with the darker circle are outstanding, but it's on a graph which includes the cost per weighted activity unit. So you can see us and the Homerton on the left hand side there, and it also includes the level of surplus that's been achieved as well. Being in the left, in that top left hand quartile, is the best place you can be. And I think there is something about that chart, it's not entirely clear, but there's something about that chart where those green blobs, so if you're a good quality trust, if you're a high quality trust, you have lower costs. However, that's not a bad place for SASH to be. We just need to catch up with the Homerton. Next slide, please. On infrastructure spend, our capital expenditure, we spent £14.6 million on improving our facilities last year. You will hear more about the neonatal unit when Avi talks to you about that. That was our biggest area of spend. And of course, that unit opened, I think, in the last few weeks fully, although we had opened part of it early previously as well. 2021, obviously, COVID makes a huge difference. So what's happened in the NHS is that previous financial mechanisms have been halted so that we can make sure there's enough money being provided to NHS providers to deal with the pandemic. So we get paid on something called a block contract stroke top-up basis. That means we just get an amount of money each month, and if it's not enough, somebody tops it up with a bit more. That regime will probably change as we go into August and September, but that's the situation at the moment. So within that, this trust plans to deliver a break-even position within 2021. That means we'll have to use some of those cash reserves that I was talking about previously, because you need a surplus in order to repay your borrowing and pay depreciation costs on your assets. But we'll use some of our cash reserves to make sure we finance that, and we're in a good position to do that. And finally, we're working with Surrey Hartlands and Sussex CCGs and the respective integrated care systems, the ICSs, there to fund and plan the restoration of services that Ian was talking about previously, so that we can manage the winter and any second surge, and we can get our services back online as quickly as we can. Thank you. Happy to take any questions.
I've got one first question for you, Paul. So I'm encouraging you to, those who are watching online, please do send your questions in. How has SASH managed to maintain a 4-year consistent surplus, particularly in this challenged environment for the NHS?
That's a very good question. Our SASH Plus has helped us do that. So that programme that Michael talked about with the Virginia Mason Institute has helped us at every level of the trust to improve how we work, so that we remove waste from what we do. We also have a very large population base around us, and there has been continued growth in demand of our services. So the other thing that we do is we treat more patients, but within the same kind of cost base that we've got at the moment. What I was describing there on agency nurses, we did spend £18 million on agency staff in 2018-19, and we spent considerably less on that in 2019-20. So a combination of all of those things has helped us to make sure that we have maintained that good financial position.
Okay. Any other questions?
Glad that you can see the slides now. That's really helpful to know. Thank you for that feedback. Got a couple of questions here. So one says, have we had the external financial support that we needed?
So during the COVID period, absolutely. We have received additional funding in respect of some of our capital costs, so for buying equipment and things like that. And one of the best things I think that the NHS did when this started very early on back in March, the centre very quickly wrote out to every NHS trust with this new financial regime. We also suspended a lot of bureaucracy around the contracting process with CCGs at a stroke, so that we could actually focus on delivering the services that we needed to do. And that was an extremely helpful approach from the centre. Yes, I can say that we've had the money that we needed.
Thank you. A couple more questions here. There's one from Brenda, which says, are you saying that paying bank staff more has meant a better service overall?
Jane will have a view on that, our chief nurse will have a view on that. What it means is that rather than relying on agency staff who may be different people who come in at different times, we can use people who are more familiar with the trust, who work with our teams already and are trained to work with our teams and used to working with our teams. Arguably, I think that provides a better level of service, and I think it's great that we've been able to afford to do that. And I think it's also encouraged a number of people who don't necessarily work full time at the moment, or may have left the service, come back and help us too. So yeah, I do think that it's helped get us a better service.
Thank you. I think there are a couple more questions. We can just go further down. There was a question about whether or not COVID has impacted. Yes, there we go. Without COVID-19, what would be the outturn? Would it have been better, or would it have been worse?
We actually, so another good thing. So We had a forecast of a £7 million surplus, and the CCGs and NHS England improvement helped to get us to that position. So even though during March we actually lost quite a lot of income as people didn't come into the hospital, so we agreed an end year settlement to cover that bit. I think we probably got to where we would have got to if COVID-19 had not hit us, but we did have help from the CCGs and NHS England improvement to get to that financial position, which was great and a good example of how organisations in the NHS have pulled together in this emergency.
Thank you very much. Keep your questions coming in. Some of those that have been posted, I think we'll probably save up towards the end, where we can have a broader discussion.
Okay, so thank you. So can I introduce Jane Dixon, our Chief Nurse, Chris O'Connor, our Consultant Admiral Nurse, and Dr. Ian Wilkinson, Consultant Geriatrician, Author Geriatrician. Just get the slides up for you, so just bear with us for a moment. Okay, over to Jane.
Thank you very much. As Michael says, I'm Jane Dixon, Chief of Nursing and Midwifery here at SASH. And you'll see in our annual report a number of initiatives that we want to share with you around quality and safety and outcomes. We particularly tonight though wanted to speak more about the work we do around dementia, caring for patients with dementia and other cognitive impairments, because we are so very proud of being awarded the best dementia-friendly hospital in the country. It's really important, I think, that we acknowledge that caring for patients with dementia and other cognitive impairments is the work of all of our colleagues, all of our nurses, our doctors, our therapists, our housekeeping staff, everybody in the hospital sees this as our business and their business. But I'm really proud to have Chris and Ian sitting beside me who have led this work on our behalf, both locally for us and at a national level. So I'm going to hand over to them, and they're going to share with us what we've done, why it's been successful, and what more we still want to do. Thank you.
So I'm Ian Wilkinson, I'm a consultant geriatrician, I'm a dementia lead doctor. And I think what we've heard already about SASH being very much one team, I think rings completely true when we think about our dementia care. And as such, when we set up our dementia strategy, we were very conscious that we needed a physician and also a nurse as being in charge of the dementia care that we deliver in SASH. And so Chris and I took on these roles between us. And we started off with some areas that we were particularly keen to try and improve on and to develop our services, because we were conscious that for someone who's living with dementia, and for the relatives of someone who's living with dementia, coming into an acute hospital when you're unwell is a hugely topsy-turvy time of things, and it's really very, very important that we get it right and get the care right for people we're looking after. And to do that, we need a team, and these changes that we're going to tell you about required a team effort across the whole trust to deliver what we thought was quite an ambitious strategy that we set for ourselves across four main key themes that Chris will take you through in a moment.
Okay, so the start of the four key areas were training and governance. So we've designed, so for example, and this is based on we have a dementia strategy steering group which oversees the overall strategy, and that steering group is made up again the whole team approach. There's physicians on it, there's nurses, OTs, but also includes external people to support us and guide us and to give us some steer. So we have the carer support groups for both Sussex and Surrey and Sussex, the Alzheimer's Society. So we ensure we capture the voice of people living with dementia and their carers, and also some external organisations. So for example, Surrey and Borders Mental Health Trust and First Community. So it's very much not just the trust ourselves, looking at ourselves, but external organisations supporting us with that as well. And so our dementia strategy had these four key areas, training and development being part of that. And so, for example, our training is, we now have sort of different levels of training. We have basic awareness training around dementia, which we use Dementia Friends as part of that. So all staff across the trust, no matter where you work, will have some training around dementia. So we have now over 3,000 staff who have completed the Dementia Friends badge, and that's really important because that gives carers and patients living with dementia reassurance that staff are aware of their needs. And by wearing the Dementia Friends badge, it's a very clear visual sign that we're really working towards being dementia friendly. On top of that, we developed a 3-day dementia leads programme. We now have over 300 staff have completed that, and that again is staff from across the whole organisation. So nurses, OTs, physios, ward clerks, nursing assistants, all have take part in that. And that shared understanding and learning helps support patients living with dementia. And also, this dementia training is weaved into other programmes. So the junior doctors training, other programs that's run throughout the hospital, we try and ensure that dementia is included within that. And even things like the MDT podcast, that we have sessions on dementia, and again, that's a multi-professional training that's freely available to people outside the trust as well as within the trust. We've also, to support our governance, we were part of the National Order of Dementia. All the hospitals in England take part of that, and that actually, when we started looking at our dementia strategy 4 years ago, really gave us some steer as to where we wanted to be to help us improve. So we used the National Order of Dementia to really guide our dementia strategy, and it helped us identify those areas that we need to improve on. So, for example, our governance. So by setting up the dementia strategy steering group, which led into the trust board, it meant that people from the board to the ward kind of knew what was going on regarding dementia. And as a result of the work we've done around our strategy, it's helped us be ranked in the highest quartile for the last National Order of Dementia. And given the success we've had, we've been now asked to pilot
So we're helping develop the questions that we're going to be using nationally for the next round of the audit.
Yeah, which was meant to happen this year, and it's been delayed because of COVID. So we now find out that hopefully the early part of next year will be the next round of the audits. We're behind by about 6 months to 8 months on that. But we're also involved in the pilot for the National Order of Dementia during lockdown. So we look at kind of questions around the impact that lockdowns had on patients living with dementia. So a big part of our dementia strategy was around engagement. So and we know, as Ian alluded to earlier, about actually the impact of being in hospital, people living with dementia and their carers is very frightening, and actually it's not the best place to be if you've got a diagnosed dementia. So it's about how we engage with patients and their carers right from the start. And so we use things like the Butterfly scheme, a nationally recognised scheme to support people living with dementia, so that our staff are aware of people who have got dementia and maybe need a bit of extra support. How we work with our carers and our carer support, ensuring that people who are carers are getting the right support through carer support from other Surrey and Sussex. We've part of our early part of our dementia strategy around engagement was looking at things like nutrition and making sure that we improve the experience of that. So all the things on the right around sort of snack boxes and improving the mealtime experience, and that included the social dining, which had a huge impact on patients living with dementia. We've seen that even looking at some of the crockery we use and the colour, because we knew there's a lot of anecdotal information out there, but we had no hard evidence. So we did a study, we weighed food going in, weighed food coming back, and we could see that actually by using alternate crockery, it had an impact on people living with dementia. And so as a part of that, again, we were ranked highest in our nutritional understanding around dementia through the National Order of Dementia. So that work was recognised through the National Audit. And also how we engage. So we engage with communities around the understanding of dementia. So we offered Dementia Friends training to our local communities, so schools, scout groups, we have lots of community groups doing things for us now. Local WI groups knitting things for us and making things for us. And so as part of thanking them for that, we go out and give them a presentation on Dementia Friends. And so again, sharing that knowledge. And just recently, and unfortunately, COVID kind of put a bit of a halt to that. We're about to start doing some really good work with East Surrey College, our local sixth form college. We have students coming here doing work placement, not only just health and social care, but even sort of the apprentices doing engineering. And we were going to do some work with them around art and using our dementia-friendly garden. But hopefully, when things improve in the future, when COVID's no longer with us, we can start re-engaging with that going forward. So we do lots of engagement with our local partners. Big part of our dementia strategy was around looking at our environment. We know that the environment has a big impact on patients living with dementia. So our dementia strategy includes kind of guidance around what's dementia-friendly environment should look like. So all new wards kind of have a template now to work towards to make wards more dementia friendly. We're delighted to open a dementia friendly open space, and then we won the award for being the best dementia friendly hospital. We were also nominated for the best dementia hospital garden. We're up against some really tough competition from some really big providers, and so we're really proud that we're in that mix for that award, but we didn't win it. I think we got the better one anyway, so I'm quite pleased about that. So what's the yeah, so still that, sorry. Next slide, sorry. And then finally about the patient experience. And again, it's through the training programs developed, it's about really the impact that dementia has on people living with dementia, and actually staff almost having more empathy and understanding and walking in the footsteps of patients with dementia, and just stopping and actually realising what living with dementia what impact it might have on them. And we know hospital is a strange and frightening place, so trying to make that experience better. And in normal times, when we're kind of fully open, we've got a fantastic group of volunteers, and hopefully they'll be coming back soon. And we had started training up dementia volunteers who are doing really good work with our patients, running knitting groups, sing songs. They supported our dementia cafe, which was a monthly sing-along down in our canteen. We had activities around using the garden. We've got movie evening, afternoon. So hopefully, post-COVID, we can go back to doing that. Lots of our volunteers are keen to get back and support us with that going forward.
So we're very conscious, though, that we're on a journey, and we've completed the first 4 years of the strategy that we set up, and we now need to focus on the next 4 years, the next 5 years, the next 10 years. And so we're rewriting the strategy to focus on our next steps. And we're conscious that we don't get it right every single time for every single patient, and that is our aim. And so that's the next step, really, is to work towards that. To do that, we're expanding our team, we're expanding the Dementia Leads programme, so we'll have more dementia champions on each ward. And we're working with the National Strategy Group and the National Audit to Dementia to try to shape the questions that get asked in the national audits to make sure that they are workable and reflect what is good quality care. We're starting to look towards more research opportunities about people living with dementia in acute hospitals. And we think it's an exciting time coming forward. So there's a lot to do still, but that's kind of what we do. Questions?
Yes, thank you very much. While we just check and see if we've got any specific questions, I have one for the team. So it's really good to hear about your partnership working with the community, and I just wondered how are partners and particularly schools responding to the sort of engagement and involvement around the dementia agenda?
So, I mean, schools and youth groups are really engaging and very accepting of dementia and have a real keen understanding to want to know more about it. I think because it touches so many people's lives. A lot of children will have grandparents or relatives living with dementia, so they want to know more. And actually, I've some of the work I've done around the schools and colleges. They're very accepting and are kind of keen to learn more and not frightened by it. I think before, people think back to dementia 10, 20, 30 years ago, people didn't talk about it, and it's far more open now. And actually, children, some of the stuff we do with children, their understanding is really reassuring and hopeful for the future.
Thank you. There is a specific question here. It says, in normal times, what percentage of inpatients typically suffer from dementia, and would more services delivered at home or in care facilities reduce the pressure on SASH and the quality of care to patients who find the hospital environment very stressful and confusing?
So we over the last few years, as part of the strategy, we've really tried to get a good handle on the number of patients living with dementia. So we now have developed a very robust dashboard which tells us how many patients have come in, how many patients, and we can tell from month by month now. And actually, even during COVID, we've seen kind of the reduction in numbers and the number of patients coming in with dementia. And so the percentage is between about 15 to 20% of patients currently, or on average, with dementia, living with dementia, who use our service. The second part of that question is, so we know that people with dementia do need to come into hospital for all sorts of reasons. So dementia often isn't the only reason why they're here. They usually come with having a fall or an infection, so they need to be in hospital for that. And so we need to be able to manage that. We are aware, and we have seen a slight increase in dementia being the hospital being used as a place of safety when families because of care breakdown or care breakdown, and that people come to hospital for no other medical reason than they need more support. So, but they're small number, but something that we are keeping a kind of watch on to see what impact that has on care going forward.
Thank you. There's a couple more questions. A question from Deborah, who's referencing specifically DNAR. Have you changed the training you provide in asking patients or relatives about DNAR? And perhaps you could explain what that is.
Yeah. So DNAR stands for Do Not Attempt Resuscitation, and I don't think the way in which we have conversations about this really difficult and emotive time and discussion has actually changed that much during recent months during COVID. I think what has happened is that we've had to discuss it more often with people, and we've had to think long and hard when we first see people that are brought into the hospital about the appropriateness of such treatments. But I don't think by and large the nature of those conversations has changed.
As part of our dementia training, we include a big part about end-of-life care and getting that right. And our new dementia strategy will make sure that we work closely with our palliative care nurses around end-of-life discussions as well, and DNAR.
Thank you. There's another question from Laurie. Is there work being done with the ICS to extend the dementia success into the community?
So, so I can give you an example of something that we're doing, more maybe at the level of the primary care network, but each of our geriatricians here at SASH is paired to a primary care network, and we link in virtually to their complex case multidisciplinary meetings each month, and we're building partnerships within that, and I think that will help improve the advice and guidance both ways, from primary care to us and us to primary care, and therefore improve the continuity of care and level of care really for people living with dementia, who are undoubtedly some of the more complex people that we look after here.
Thank you. And thank you, folks. Thank you, team, for everything you've been doing. So I'd like to introduce Dr. Avi, our lead paediatrician, who is going to talk to us and to you about some of the fantastic work that's been going on with neonatals.
Thank you, Michael. Just wait for the slides to come up. Right, thank you, Michael. My name is Avinash Ramadan. I'm consultant pediatrician and lead for pediatrics, and it's my absolute pleasure to present to you our new neonatal unit. Next slide, please. So at the beginning of the millennium, we were delivering around 2,000 babies a year, and now that figure is now doubled to more than 4,500. Around 500 of these babies actually need admission to our neonatal unit each year. Our trust invested, as Michael alluded and Paul mentioned, over 8.5 million in investment towards the building of the new neonatal unit, and this helped transform our small facilities into a more modern, spacious environment with all the latest advances in safety and technology. The work for the neonatal unit started around a year ago exactly, and it was completed in 3 stages, which meant that we actually had to move 3 times within the building itself, and 2 of those events happened around Christmas last year, Easter this year during the pandemic, and the final move was completed in May 2020. Next slide, please. And throughout this period of the build, babies were continued to be cared for in the unit, and our highest priority was towards the safety and the stringent infection control during the care of these babies, and that was the highest priority. And there you see a lovely picture of our triplets who graced our units, who were the first to grace our unit. And the story goes that when we were moving from phase 1 to phase 2, where we were just planning to get ready to move all the babies over from the old bed to the new bed, the emergency buzzer goes, 31 weeks gestation, triplets coming at the same time, and you can just imagine the adrenaline, the buzz, and the activity, admitting one neonatal baby, a preterm baby, as goes everything that goes around it. But you had 3 on the day of the mow, and the staff manages fantastically well. And you can see there a lovely picture of the triplets who did very well just before they were being discharged. So our capacity to look after these babies has increased. So we previously had 20 cots, and this has now increased to 25. But also our capacity to look after the sickest of the sick has doubled. So we previously had 2 high dependency cots and 2 intensive care cots, and that's now doubled. And what's really noticeable, especially for someone who's actually been in the previous neonatal unit, is the space. The space around the incubators has nearly quadrupled, so a ballpark figure for 4 meters squared around each incubator previously, and now 16 meters squared. And that includes a dedicated space for both parents to sit by their babies, with a clearly defined personal space marked by different floor colouring. And a lot of thought had gone into basically creating a better environment. And now the unit includes a comfortable breast milk expressing room for parents. It includes a quiet room for professionals and parents to discuss things. There's also 2 side rooms with en-suite facilities. So if parents needed to stay whilst the babies were being cared, that can be facilitated. And the overall decor offers a much more friendlier environment. It doesn't feel like we are entering an intensive care environment. And a lot of credit for that actually goes to the initial consultation phase, where both staff and parents had quite a lot of significant input into the design and facilities of the environment itself. And apart from the space, and what's really noticeable is the state-of-the-art equipment, and that includes incubators. And these incubators, apart from what a basic incubator needs to do, also allows parents to record their voice, a lullaby or a story for their baby that can be played when they're not there. Light and sounds can be controlled for the babies to gradually gain awareness of day and night, which aids the development. Please. And as Michael already mentioned, we have been incredibly grateful for SASH Charity and the Olives Appeal, which contributed a great amount. And because of that, that has now helped fund an additional family room, purchase more incubators, and comfortable reclining chairs. And we are ever so grateful for the support, and thank you to the community to support the Olives Appeal funding. And there you can see a lovely picture of little Olive Murray, and she is now 4. She's in that picture pointing to her own picture when she was in the neonatal unit. She stayed on the unit for over 100 days. And look at her, she looks absolutely gorgeous right now, and we are ever so grateful for her efforts. Okay. And I think what's important to mention that since the unit has now been fully functional, the feedback from the parents of actually babies who are being currently cared for, the feedback has been absolutely fantastic. We've started what we call parent-led ward rounds, where once a week. Actually, it's the parents taking the lead on the ward rounds. They are actually presenting their own babies and taking the lead and asking questions that they want to know answers for. And none of this would obviously be possible without the fantastic nursing medical staff that we've got on the unit. And for me, it's an absolute privilege to work alongside them. Thank you. Happy to take questions.
Thank you very much, Avi. You actually just answered the question I was going to ask about the response of families and parents to the new environment, because this is really a state-of-the-art facilities that we now have.
Absolutely. Actually, it's quite interesting because, as I mentioned, there were 3 moves. So during these moves, there were some babies who were actually going from the old bed to the new bed. And actually, it was really good to see the feedback your parents were seeing, that they were actually seeing the difference from how the old unit looked and the new unit, and it's and the feedback has been fantastic, and we continue to collect feedback because we want to carry on building on the infrastructural investment we've had, because there's lots more we can do, and but the feedback has been fantastic. Thank you.
Thank you very much. We have some more general questions which we'll take. And the first one says, are you looking for support from neighbouring hospitals to help you with your endoscopy backlogs? And what support are you giving to them?
I said that.
Yes.
Yeah, we are. We're working with all the Surrey hospitals actually, and with the Sussex hospitals, but particularly the Royal Surrey County Hospital in Guildford and at Ashford St Peters, to look at how we can work together to reduce the endoscopy backlog. And we're going in the right direction. As of Monday this week, on the endoscopy waiting list, we had 2,345 patients. So we're managing this on a daily basis now. And it will take us some time to get down, to get those numbers down, but we've got a very clear trajectory to ensure that we are looking after those patients. I will say the one thing we are doing is working very closely with the clinicians who are reviewing those patients who are waiting long periods of time to make sure that we're treating the right patients in clinical order, and ensuring that those patients that go on to the time critical surgery get that at the earliest opportunity.
Thank you very much, Michael. There's another question here. It says it's fantastic that over 800 patients recovered from COVID-19. How many sadly died?
Yeah, so sadly, some patients did pass away, and it was around 267 patients actually, unfortunately, did die. And our deepest thoughts go with all of their families and relatives and loved ones.
Thank you. There's another question just below. Yes, can you tell us a bit more, says Laurie, about the Virginia Mason Institute?
I can, but Jane, do you want to say that one?
So I'll talk to that. Thank you very much, Michael. So we have been working in partnership with Virginia Mason for a number of years now, and it's been a collaboration we've done with a number of other acute trusts in the UK, and it's really very much about, they pride themselves on their lean approach, their lean methodology, really improving and increasing value for those that use the service and for those that deliver the service, and looking for standard work, consistency, and looking at taking out waste in the system and adding value. So we've been doing lots of work with them. A number of us sitting here have been to Virginia Mason in Seattle and seen their work firsthand. And we work very closely with Sensei that come here to work with us. We then take that work from Virginia Mason and we take it into our own SASH Plus methodology, which means that we've put significant numbers of our colleagues through training, both Lean for Leaders as we call it, or advanced lean training, and taster sessions, where we're able to enable our colleagues working close to patient care and in other supportive roles across the trust to pick up those methodologies and to apply them into how we care for patients and support each other.
Thank you very much, Jane. There's another question, and I think this one is also for you, Jane, from Laurie. It says, will Brexit have an impact on recruitment, especially of nurses?
Thank you. So, I mean, that's the million-dollar question that we were all asking in the lead up to Brexit. And for us as a trust, as already was alluded to by Michael, we consider ourselves very fortunate that we have a very, very, very small registered nurse vacancy in the trust at the moment. But actually that's been because of a lot of hard work, and that has relied heavily on both local recruitment but significant overseas recruitment. What we do believe is that Brexit has the possibility to impact on recruitment, not just of nurses, but of other support workers we have in the Trust, particularly our estates and facilities colleagues. A large number of those have joined us from parts of Europe. However, of course, it's incumbent on us to make sure that we retain the colleagues we've got, and that we look to support the local initiatives in the country around increasing their training and looking at local recruitment. So I think there's a potential impact of Brexit on recruitment. However, we start in a really good position for that not to impact on our patient care. What is sadly a significant impact for us currently is our overseas recruitment from further afield. With COVID, we've seen a number of colleagues that were due to join us from overseas who haven't yet arrived.
Thank you very much, Jane. I just want to remind you that now is the time, if you've got a burning question, just to post that so that you don't lose out. We have a question here maybe for Avi. A comment, I think, said, I had my youngest child cared for in your old special care baby unit, and this one looks great.
Absolutely, you can come and have another one, but I do wish you don't need an admission to the neonatal unit, but if you do need one, we're ready for you.
Thank you. Ian, I think this one might be for you. An excellent AGM presentation. Thank you on behalf of the team. It says remote works well. COVID-19 has enabled a lot of changes to overcome not possible barriers. What changes, such as remote consultations, do you wish to continue into the future?
As I said in my presentation, I expect remote consultations will be here to stay. You know, it is one of the benefits of COVID. It has forced us to use technology. It has forced us to think differently about how we deliver care. And there's no doubt that remote consultations are extremely convenient for patients. And it's allowed some of our clinicians who were, you know, shielding or, you know, working from home to have these remote consultations and continue to deliver patient care in difficult circumstances. I think I don't think they will completely replace an outpatient face-to-face consultation, because there are times when as clinicians we need to see you, and that's particularly the case around you know, examining patients to elicit physical signs. We obviously have to see you then, but remote consultations are here to stay.
Thank you very much. I don't think there are any additional questions that we've received. So I'm going to hand back to Michael.
Yes, so just to say again, a great big thank you to all of you in our communities and to our staff here at SASH. We have had a fantastic year, full of highs and full of lows. We look forward to serving you going forward, and we wish you all the best. Just before we move on, I think Richard wants to close.
Thank you, Michael. Well, thank you very much to everyone who's joined this annual general meeting, for raising your questions, and I really hope you've enjoyed it. I enjoyed it, I must say, listening to it all. If you would like more information about the work of the Trust, our annual report for 2019-2020 will be available on our website very shortly after this meeting, and you'll be able to download it from there if you wish. I would like to echo the thanks of Michael and others this evening for all the support that we get from our community, both in your donations, in your behaviours, and in the way in which you're helping to stop the spread of the virus as well. Particular thanks to Jamie Whitburn, who's off camera, but he and his communications team have done a sterling job in organising this event, and also the online facility that we've all been using, I think in this way for the first time as a live event. And it's worked pretty well, I think. I'm sure you've detected this evening through all of the presentations that we have immense pride in our staff, and we take great pride in our achievements as a trust. I think you may also have detected a strong sense of momentum here, and that it's an integral part of our DNA as a trust that we have an ambition always to provide an ever better care for the people that we serve. And as chair of the trust, it really is a privilege to be associated with this trust and in a small way to be able to support it on its journey. So thank you very much to everyone for taking part. I hope you've enjoyed the evening.